I am pleased to introduce today's speaker, Marielee Santiago-Rodriguez. As the Director of Transformative Knowledge and Education at the MetroHealth Institute for Hope, Marielee is the go-to resource for the Clark-Fulton community. With over a decade of experience as a licensed medical social worker, she has dedicated herself to addressing social determinants of health within diverse grassroots communities. Today, she'll provide us with insight into the Viasana Project, a modern living apartment community for residents earning at or below 60% of the area median income in the Clark-Fulton community. MetroHealth's Institute for Hope aims to address the community's social determinants of health, and Marilee's work is creating vital space for education and training to improve health outcomes. She is an alumna of our Cleveland Bridge Builders class of 2022 and was recognized as one of 100 plus Latinos Cleveland must know in 2021. We are thrilled to have her join us today and tell you more. So without further ado, let me introduce Marielee Santiago-Rodriguez.
Thank you, Angela, and it is a pleasure to be part of the CLC Lunch Way Forward today, as well as a proud alumni of 2022 class of Cleveland Bridge Builders. So it is an honor and a pleasure to be here today. So I'll go ahead and get started by sharing my screen. All right. So to set the stage, I want to go ahead and introduce the work that we do here at MetroHealth Hospital. It is a Guardians of Health. We are the Guardians of Hope. We focus on serving the most at need, the most at risk within our communities. We've been serving the greater Cleveland area for over 180 years at this point. We are open and accessible. We're 10 minutes away, as long as you live in Cuyahoga County, to a MetroHealth facility. We are the region's essential public health leader during a crisis. We provide care at 4 hospitals, 4 emergency departments, more than 20 health centers, and over 40 sites in Northeast Ohio. And we operate as Ohio's top rehab center in the region's most experienced level 1 trauma center and the only adult and pediatric trauma and burn center in the state of Ohio. A little bit about the department that I work for and I represent as a Director of Education and Training. Within the Institute for Hope, it was developed July of 2019 with the focus and intent of screening our patients for social drivers of health. We connect to address those individuals with those most at risk to those key drivers of health, such as food insecurity, housing, transportation, financial coaching, just to name a few. We also focus on data collection and data analytics to identify social risk factors and how that ties into health outcomes within our patient population. And then ultimately, the work that we do, in essence, is to ensure that we're doing this through the lens of research. So we have direct programs and interventions within the Institute for Hope where we we can demonstrate impact and provide evidence-based research to prove a concept in essence of how do we go beyond the 4 walls of a hospital system to address and improve the health of our communities. HOPE stands for Health Opportunity, Partnership, and Empowerment. And we've really emphasized on partnership as the work that we do. It can't be done alone. We have, we focus on collaboration, especially community-based organization collaboration. So moving forward on to the work that I am focusing on and I'm working within the Clark-Fulton neighborhood. I'm also proud to say that this is a community that resonates with me as a Latina, Puerto Rican, that grew up in this neighborhood and representing over 46% of those Latinos that live within the Clark-Fulton neighborhood is one of the highest percentages of Latinos within the state of Ohio. So it's really important to understand and note that. And then as we think about the social determinants of health, how MetroHealth's approach took a lens around the Clark-Fulton neighborhood and around investment and engagement. Within the Institute for Hope, as I mentioned, we focus on the social drivers of health. Within each category, we're able to take a deep dive and, look at data, public data that is available. And this is information from Community Solutions 2021, where we were able to go into, the data and, understand what are the economic conditions within this community, right? What are the educational conditions within this community? Things like, looking at child poverty, education attainment rates within this community, right? Social and community content. When we think about registering to vote and voting, who shows up, and to ensure that we have, a large representation of civic engagement and our voices are heard, as well as health and healthcare, right? Understanding what are the disparities, what are the inequities within this community, that we need to pay attention to and focus on. And then, or such as diabetes, depression, right? Hypertension, you name it. And then neighborhood and built environment, right? We understand, or based off this information that we have here, that over 50% of the households within the Clark-Fulton neighborhood are burdened by unaffordable housing, which, with costs consuming more than 30% of their gross income. So that, shows that about 1 in 3 households didn't, are affected by that, but also around digital inequities too. Internet subscriptions were really low in 2019. And I will state a tidbit that although in 2019, Cleveland was one of the worst connected cities around internet access and broadband access, as of 2025, we are one of the most improved cities affected by the digital connectivity inequities. So that's and MetroHealth was one of the pioneers in partnership with CMHA, Digital C, and Dollar Bank in ensuring that we changed that around. So about Viasana, right? Viasana is a 72-unit mixed income affordable housing in the Clark-Fulton neighborhood. It was developed through a partnership with NRP Group and the MetroHealth system. And the aim was to address the social determinants of health by providing high quality, affordable housing and community resources. Its origins come from 2018 through the Ohio Housing Finance Agency, that it was awarded to the city of Cleveland of $3 million around in housing tax credits that support mixed income neighborhood development. So with this proposal, the city of Cleveland designated a target neighborhood for these tax credits. And through the Office of Economic and Community Transformation, MetroHealth, that partnered with Metro West at the time, and the Clark-Fulton neighborhood was designated as the target area for affordable housing. With this development, the CCH development, which is a separate nonprofit organization affiliated with MetroHealth, they sought this proposal from developers that were wishing to partner and co-develop a mixed use of affordable housing project that would integrate wraparound skill development programming. So NRP was the identified property management company that constructed and manages and now manages the 72-unit affordable housing complex on main campus of MetroHealth. And then they left a space, which I'll talk about in just a moment, which is connected to the community where MetroHealth manages and oversees. The target population designated for this apartment complex is for those residents that are earning at or below 60% of the area median income. So you have people paying market rate. There are individuals that have a housing voucher through CMHA, as well as based off their income, right? So, you have individuals at 30%, 50%, or 60% at any given moment living here at Viasana Apartments. It has a modern design, affordable, accessible, and it's transit oriented. Right outside of the MetroHealth Opportunity Center at Viasana, you could see the RTA bus stop, which enhances accessibility. So, about MetroHealth Opportunity Center at Viasana. It's within the Clark-Fulton neighborhood. It faces West 25th. It is a community space to help you find where you can find education and training spaces, workshops for anything from cooking demonstrations, financial literacy workshops, and support groups. We are very pleased to partner with MetroHealth departments such as our HIV department, who provides support groups to our patients throughout the month. And it is a permanent space for Tri-C Access Center, where we're able to deliver workforce and educational classes, things like medical terminology, introduction to pharmacy terminology, as well as learning the basics of Microsoft Office suites. So since opening in the fall of 2024, the center has hosted over 130 events that have served over 1,000 individuals. And again, this is a space for community, right? This was an investment for the community, one of, not just with public funding, but there was also philanthropic funding. Key Bank was invested into this space, and ensuring that we are providing economic opportunity within this community. That's why we can provide financial literacy workshops, financial coaching, one-on-one, and we're doing it in a culturally inclusive way with bilingual staff, and ensuring that we are, engaging with the needs of the community. By partnering with community-based organizations that represent and serve this community. And then those that don't, right, but would like to, and those are resources that can be a benefit for this community. We are engaging with those partners and making sure that they provide resources and educational workshops out of this space. We've done mental health first aid trainings. We've done Stop the Bleed trainings. We've done partnerships with organizations like CHN, and much more. So it is really exciting that we have this community space. There's a classroom space that holds up to 24 people. You can change it up at any given moment, take away the tables, and have a crowd of 50 plus people. We have a cooking demonstration space, kitchen area, as well as a conference room, and then huddle spaces for people to meet with their clients in the community. So you have organizations that are able to do that now at no cost. I want to emphasize that. And so moving forward into our strategic vision for Via Sana, around it's a true emphasis around the four pillars that I call it, four pillars of opportunity, from education, workforce, health education, and general SDOH. And each pillar, I have set a goal and initiatives, and as well as metrics that we hope to achieve within this newly established place, right? We want to make sure that we're empowering our patients, residents, through access to lifelong learning, but by providing educational classes, digital literacy education, as well as partnering with local schools and colleges for continuing education. And then, with the goal, as we saw with the statistics within the Clark-Fulton neighborhood, right? If there's a low high school, low education rate, right? We want to increase that educational attainment. We want to enhance the community engagement and build self-sufficiency, as well as through workforce, right? By job readiness programs, vocational programs, apprenticeship programs, on-the-job programs. And then within health education, looking for those partners as well, given that we are a health anchor institution, we have the resources there. So we will be, we provide, promote wellness and preventative care through knowledge, right? From health screenings to collaborating with, other organizations to host a community baby shower, right? And then various departments within MetroHealth to engage with the community and provide health education with the goal and intent of improving health literacy and reducing preventable health issues. And then general SDOH is where we can create a supportive environment that fosters overall well-being through initiatives of addressing food security programs, financial literacy, as I mentioned, community engagement, with the goal and intent to improve the holistic health and quality of life of our patients and residents of Clark-Fulton. So why does this matter? I want to make sure that, we understand the concept of what we're doing here. This is the social care logic model through Siren that we have adopted through the Institute for Hope, where we look at multiple complementary pathways that lead from SDOH screening to improve health and healthcare utilization. Our first point of contact or connection is identifying those unmet social risks, right? So that's where we screen our patients for social drivers of health. And then where I highlighted in the second pillar there under connect patients with social services with or without social services navigator is where I envision where that, Via Sana plays a role, the opportunity center, right? We may not have an active community health worker there, but we have programming in place to address those social needs within our community, right, and our patients. With the focus or the goal of decreasing those social risk factors, right? Housing instability, food insecurity, transportation concerns, education, workforce, right? Health education, to then overall with our end goal of improving health and in decreasing avoidable healthcare utilization. And this is a snapshot of those 130 events that have occurred. I couldn't fit all 130 on this slide, but this is just a snapshot of what you'll see at Via Sana if you ever had the chance to come. We've hosted dance classes for our local grassroots leader in our community, who is also a high school teacher at Lincoln West, Rosa Cruz. She's used the space last year for her kids. We've hosted mental health first aid training in Spanish for bilingual professionals. We've hosted financial literacy workshops, right, around budgeting, saving, how to purchase a home, right? And then health education, right? We, again, as I mentioned, we're a health anchor institution, so we want to make sure that we can do things like CPR training and first aid training there. And then just to wrap up here, Your Voice Matters is a campaign that we're doing right now in the Clark-Fulton neighborhood. We're hosting 3 community listening sessions that are coming up. This Tuesday is the first one from 6 to 8. And with this is to really engage the residents of Clark-Fulton on how the Opportunity Center at Via Sana can best meet their needs, right? It is really important for me to really hear what the residents of this community would like to see out of this space, right? As it is a newly established place, we are doing great programming there, right? We're already booking the spaces. Our secretary every day, she's like, Marielee, I got 5 more people that are wanting to book the space to host a training or a workshop there, which is awesome. But at the same time, it is really important that we meet our residents where they are and our patients. So getting their feedback is where is really crucial for us to capture. Earlier this year, we were able to meet with Clark-Fulton stakeholders in the community, where we all came together at Via Sana. It was about 20 of us, 20 stakeholders, where we looked at the statistics of this neighborhood. We looked at ways that we can see within the SDOH screening that what we're seeing thus far, that the residents that live in the Clark-Fulton residents, our patient population, they're screening the most at risk for food, stress, utilities, finances, and housing stability. And about 27% of that population, about 3,000 of those residents that have completed the SDOH screening within the MetroHealth system have requested for help. So it goes to show the need and the importance of us being present and vital to the community. And lastly, how to connect with us. You can connect with us through our webpage, which is the metrohealth.org /Institute for Hope /Opportunity Center. So you'll get to see what's the latest and greatest around the Metro Health Opportunity Center at Via Sana. And if you have any questions and want to connect with us, feel free to reach out to us through via our webpage. All right. Thank you.
That's
And
great.
I will
Thank you.
stop sharing.
Yeah, now we'll head into some questions. I'm so glad you mentioned those listening sessions because the first question is just how do community members learn about the opportunities in the center and how do you work to make sure that they attend to use the resources that are available?
Yeah, that's a great question. So we're in, so it is dependent on the community partner that is booking the space. They promote the activities, and we also are able to upload the flyer, the information via our website. We are in a process of working through a marketing and communications campaign as we speak. So we have done campaigning to our internal stakeholders within MetroHealth to get the word out about Viasana and how to access those services. And then now we're through these community listening sessions. That's our next pathway of how we go into the community and, get where are the best places to connect and get the word out about what's happening at Viasana.
And I think you mentioned a couple, but who are partners that are providing the content for these workshops and where are you looking for more? Where could you use additional partnerships?
Yeah, so a lot of our partners are actually within the Institute for Hope programming that we provide. And as well as Metro Health partners, like as I mentioned, we have different departments throughout Metro Health that are providing these services. And then for the community or out in the community, we have had partners like Cleveland Housing Network. We've had partners like Planned Parenthood, the National Association of Mental Illness. We have had the city of Cleveland provide housing workshops at Viasana. Yeah, we've had a range of even the Board of Developmental Disabilities. So it's a broad but well thought out list of partners that have already expressed interest and or utilized the space.
And sticking with the theme of partnerships, you mentioned the essential partnerships with MetroHealth, NRP Group, Tri-C, that are demonstrated through this project. So, what are some of the unexpected benefits of having all three of these institutions collaborating through this project?
I think it really goes to show the influence and power of connection, right? It really helps us get the word out with their support, right? So if, one of our partners is hosting an event at Viasana, we can reach to our dedicated partners who are well established with us and get the word out of what's happening at Viasana. So getting their buy-in, right? It's no questions asked. They come, show up, and they're able to support us.
How can Viasana be an example to replicate for others in the Clark-Fulton neighborhood?
Yeah, I think it's we're doing that as well within the Institute for Hope. We have a center, an opportunity center in the Buckeye neighborhood as well. That falls or sits within a health center. It's a little bit different than Viasana, and we have permanent space there for community-based organizations like Goodwill, CHN Housing, Legal Aid. Um, and again, we're providing these spaces at no cost to community-based organizations that are, really trying to provide that one-stop shop to our community.
What lessons learned would you share with other communities that are looking to do something similar?
Lessons learned. Wow. I would say it is really important to show up in community, right? It's not just about, putting up a brick and mortar and then just saying, oh, you will build it and they will come. You have to go to them, even when you are building it within the neighborhood, right? It is really important and that's what we did prior to Viasana opening. We had the privilege to be awarded with the Ohio Health Improvement Zone grant a couple years ago, and that allowed us to provide funding to community community-based partners in the Clark-Fulton neighborhood where we were able to get out, support their events, engage with the residents, let them know about Viasana, how to access our services. And that really demonstrated, the buy-in and the support that when Viasana came to be, right, when I opened the doors, the fall of 2024, that those same partners that we were able to financially support and show up and be consistent with, that they were able to replicate that or reciprocate that, sorry, back to us, and be that partner, the consistent partner to support the work that we're trying to achieve here.
And you've had such a passion for grassroots efforts, and I know you know community members by name and their stories. So, is there an example of a success story that you've already seen that you can share with us?
Yeah, I mean, I can say that through our financial literacy workshops, our financial coaches were able to connect with some of the residents that live in the Clark-Fulton neighborhood. And it was out of a flyer that they saw. They ended up at the financial literacy workshop, which was held the fall of this past year. And through that, the individual was able to not only engage in financial coaching, but now she's in the process of home ownership. And that's not something that she would ever thought that she would achieve, right? So I think the power in partnership, the power in getting the word out is really crucial because you never know who may need or who is looking for that information or doesn't even, they won't, or someone that doesn't even know what their potential holds of becoming a homeowner, right? Or a small business owner. So I think that that's what a huge success story for us.
Yeah. What's the vision for the future? How do you know this is working?
Yeah, so as I mentioned, or I shared the strategic vision, we are collecting data. It's really important that we're not only just collecting data, but we're also collecting information from our partners, feedback from our partners to understand like what are ways that we can improve, how is this working, and is this something that is worth the investment?
Were there other places that you looked for inspiration to build this?
Well, this was prior to my time, so I will say that it wasn't a decision of mine, but I think that it was a well thought out decision that was a partnership with Metro West at the time, City of Cleveland, Jasmine Santana is the councilwoman of this neighborhood. They all played a big role in identifying how Viasana came to should look like and how it came to be.
And then how can all of us on this call best support the work that's being done there?
Get the word out. So let people know that, if you are a community-based organization that is looking to host a workshop, looking for space to provide, and doing it in a culturally inclusive way, right? I think it's important that we are being considerate of this community. Again, as I mentioned, over 46% of the population is Latino. So doing it in a way where we can provide the services in a bilingual format is really important.
Absolutely. Well, Marilee, thank you so much for taking time to talk to us today and for filling us all in on the great work that's being done at the Institute of Hope.
Thank you. Likewise.